A warm welcome back onto the program. It's still a conversation here on Lagos Television. We told you before we went on that break that today on the program, our focus shall be on the World Immunization Week 2024. Now, it is a week set aside to create global awareness, that is global public awareness on the health campaign and increase coverage of immunization against vaccine-preventable diseases around the world. We have guests in the studio this morning who will help us take a look at what this is all about and how we all can be part of the process at ensuring that the campaign at taking this to the very grassroots is sustained. Join us this morning as we welcome our guest. With us here on this side of the table, Mr. Olatunde Adesoro is the Chief of Party Save the Children International, GSK, Improving Immunization Coverage in Nigeria project. Thank you for being here this morning, Mr. Adesoro.
Thank you very much.
On the other side, with Joy, we have Dr. Iritiola Fajolu. She's an associate professor and consultant pediatrician at the Lagos University Teaching Hospital, Loth. Thank you, Prof, for being here on the program today.
Thank you.
And also sitting close to Prof, we have Alhaji Latif Akimborode, is Executive Director, Community Women's Rights Foundation and Alliance Chairman, World Health Committee, Ikorodu Local Government Area, Lagos. Thank you, Alhaji Akimborode, for being here on the program today. And representing the Permanent Secretary of the Lagos State Primary Healthcare Board is the State Immunization Officer, Ms. Oluwakemi Oshodi. Thank you for being here on the program today. All right, Joy, you can start.
All right. So, yes, it's World Immunization Week. And so the question is for you, Prof. So I met a woman who has 3 children. Her last child, let me say last because she doesn't want to have anyone again. So her 3rd child is a year, 6 months. And I was asking her, so where do you immunize? Where do you go take your children to for immunization? And she was like, Ilonjebe. And I was shocked in this present day and age. And I was trying to educate her. And she was like, no, she doesn't believe in it. You know, but I couldn't talk her into it. So it shows that some people are not aware of what immunization is, how important it is for the children. So I need you to tell us, what is immunization and what benefit does it have for the children?
Thank you very much, and thank you for having me on this program. I'm representing the Pediatric Association of Nigeria, and I bring greetings from our president, Professor Ekane Mekure, who is unavoidably absent today. Now, to go to immunization. Immunization is, I think, I'll call it God's gift to mankind through science. So, what it involves is introducing a disease in a very low quantity into somebody's body. Parts of the organism that causes infection or this disease, germs, let me say the germ. So a bit of that germ is introduced into the body. So the body recognizes this as the infection and now builds up fight against this disease. Okay, so it builds up immunity against the disease. But what you've introduced is not enough to cause the disease, to cause that infection. But the body sees it as an infection and it fights. Such that when that person is now faced with that disease, the body is ready, already has its arsenals to fight that infection. So the person is not infected. Even if they are going to be infected, the body remembers that, oh, I've met this thing before, and it now engineers its immunity again to fight that infection, such that that infection cannot even have hold in the individual's body. And immunization has been since the days of smallpox. I'm not sure how many people remember what smallpox is, but smallpox was eradicated from the world. And it started with one doctor who realized that people who were exposed to what we call cowpox, milkmaids that were exposed to cowpox, did not come down with smallpox that was killing people then. So what he did was he got a bit of that pus from a milkmaid who had cowpox and injected into a young boy. A few months later, he exposed that child to smallpox, and the child did not get smallpox. So, you know, that was how immunization began. And since 1980, before then, smallpox had been eradicated from the world. We've already also gotten to, we're almost there with polio. All these diseases are killer diseases, especially for young children. So the expanded program of immunization came up in 1974, and that's why we're celebrating 50 years of that this week, so that our children should not die unnecessarily from infections that can be prevented, you know. So it pains me when I see a young baby that's just been born because the mother did not get tetanus immunization. That child is having spasms and eventually may die from that infection. Why do we want to waste our children's lives?
There are some vaccines that the mother should take while pregnant.
Yes.
That can also prevent the child.
Yes.
All right, I'm sure that we would also ask, as the conversation continues, the Prof to also give us some of those immunizations that are important for mother and child. But let me come to Ms. Oshodi. Of course, the celebration of immunization week, why is it important?
Thank you for having me here. Thank you for that question. The celebration of immunization, World Immunization Week is important because, as she said, immunization is a way of introducing a disease, in maybe a live disease or a killed disease, into the body so that the body recognizes that immunization prevents or protects a child or an adult, as it were, against this, the fatality of this disease when this person is introduced to this infection or germs. And then for the states, we'll talk about demand and supply. So the demand for this immunization is when we talk about demand generation, demand creation, community engagement. We talk about allaying the fears of the community members through risk communication. You're talking about the rumors going on, like, I don't know if you're aware, we had HPV vaccine introduced recently, and we had a lot of rumors going on about it. So what the state is supposed to do is try to allay the fears and address the rumors ongoing, or the rumors, that's crisis communication now, address the rumors ongoing and try to bring out literatures and facts about the disease or the vaccines itself to allay the fears of the populace. Also, we'll talk about the supply at this end. Supply of vaccines. Now we have fixed sessions at the health facilities. We have outreach, community outreaches done, and we introduce this vaccine into the community. We, for the 0 to 5 years, we take the vaccines that are meant for them, and then for HPV, that's 9 to 14 years now, we take the vaccines into the community to find those children and get them vaccinated. Also, we have COVID vaccine, and then we introduce and give this the birth cohort of this vaccine that need this vaccine rather. Also, we'll talk about partnership with funders like GSK, Save the Children. We'll talk about WHO. We'll talk about UNICEF, how they fund these programs, and we also have public-private partnership in immunization, where private facilities come to get the vaccines and then give to
those who need
it in their facilities. And then we'll also talk about I've talked about community engagement and then community outreach as well. We know we have some hard to reach areas. Like I would give Amuwo, like Amuwo, LG has a lot of riverine settlements, and then getting this vaccine to them, it's kind of a heavy task for the state as well, because I would use Tomaro as an example. They do not have a power supply in that area, so you need to take vaccine to them every day. And the government is doing this, you know, to prevent this vaccine preventable diseases from children from coming down with these vaccine preventable diseases. And the states actually and the federal government is actually doing a lot.
Okay. I'm sure we would come to that area where we again break it down and take a look at the intervention of the states. Ajibala.
Okay, my next section will go to Olatunde. Of course, Prof. and Oluwakemi, they have laid the foundation as to why immunization is very important, and of course the essence of the celebration of the World Immunization Week. I just want to know what is Save the Children group like yours are doing to support the government in ensuring that they create access to immunization, especially at the community level.
All right, thank you very much for that question. And on behalf of our country director, Don Kahavi, I want to thank LTV for this opportunity. As you rightly said, our role is supportive to the government. Constitutionally, the government has the responsibility to take care of the health of the people. But the NGOs like Save the Children come in to support the government. And in doing that, the government has structures for carrying out immunization. In particular, the Primary Healthcare Development Agency, the national body and the states, and also the local government health authority. So the function of Save the Children is to support the structures of government in terms of helping them to raise funds because health is capital intensive, supporting them to have policy, to develop policy direction for immunization, and also to support them in their coordination activities. We also support in the area of advocacy, also in the area of community mobilization as stated earlier. And what is unique with Save the Children is that we work particularly with children and for children. And the vaccination that we are supporting is to the children, actually. Okay. And our role is to help government to fill the gaps, as I mentioned, and it's a supportive role. In terms of also what the government does, we also support them with research so that they can make informed decisions with evidence and best practices. And all these are geared towards managing the limited resources that is available, and also developing innovations and piloting innovations that the government can scale up on a larger scale. Okay. So we've been in Nigeria for a long time. And in fact, Save the Children as an organization is over 100 years. Wow. And we'll be supporting the cause of children for them to survive, for them to be protected, and for them to be educated, okay, so that they can achieve their potential in life. So these are the areas where we come in.
Okay, let's come to Alhaji Akinborode, because you are a grassroots person and you are in the community. And like Joy rightly said at the beginning, sometimes some people do not even know, they're not aware of some of these immunization exercises, even though government is trying, especially at the local level, to ensure that all communities are aware about this. So if you'd like to tell us, what are some of the hindrances that you see, especially at the community level?
Thank you very much. Thank you for bringing me here. Yes, as a community leader that I base at the community level, we represent the interests of the member of the community. What we do is that we move around the community to see the affairs of everybody in respect of going to the facility for immunization, for any other kind of services. And in due course, we have a committee that we are meeting, and we discuss issues that are related to the facility on a monthly basis. And from there, we identify women, pregnancy women, and non-pregnancy women. We move around the community to educate our women. We go to artisans, meetings to let them know the importance of going to the facilities for immunization. You know, Ikorodu, Ikorodu is one of the community that we have the population that are
Huge
people are
population.
coming to the area on daily basis. So it makes it more easy for some of the community leaders to reach out to some of them. But at the same time, we try as much as possible to locate some of our women. But if you look at the traditional birth attendants in Ikorodu, they are more in Ikorodu than any other area. So most of them are confusing some of our women.
Okay.
Now, why do you need to go for
Your
immunization or to health center to get anything or to treat yourself? Since we are here, we can do it without any medication.
Okay.
We can use any traditional way to heal you. So, you know, and some of our women, they don't want to go far. And the location of our facilities at times is far away to them.
Right.
Some of them, they don't have transport money. Some of them, maybe their husband don't even believe in immunization. Or they believe in traditional way of doing things. But through our moving around, because we know ourselves,
Yes.
we talk to some of the traditional birth attendants, because government really empower them. They encourage them to reach out to the facility. So the primary health center and the TBA, they are working together. So if there is anything at all that they could not be able to do, they reach out to the facilities. Some of the challenges we are facing is that some women, they will be pregnant, their husband will not be responsible. And due to that, some of them will be afraid of going to the center because they know that they will pay little money. Because they don't have money, they will say, no, I will deliver it. Maybe I've already have one before, and I will deliver this one by God's grace. But somebody like me, I will use myself as an example. At least I've already helped like 3 women that I will just see on the road. I park. Madam, have you registered for antenatal? I say, I don't have money to. What happened? And somebody pregnated me somewhere, and the person ran away or whatever. I will be the one to take the person
To the
health center. And I will be the one to continue to monitor her until, in fact, some of them, I'm the one that will even be the father.
of those children.
Naming ceremony. And go with my family to do that. So about at the same time, Lagos State government, they are trying.
Okay.
But they need to put more efforts. The community that was putting on ground at the facility level, we are not enough. Okay. And it's on we volunteer. For the past 11 years now, we have been on the community level without any even sitting around to move around. And we are using our resources to move around, like our car, particularly in some facility that there is no ambulance. We use our car to rescue women from the home to the facility. So,
all right. Joy, your next question to Prof.
So we cannot stop talking about how important immunization is. So I need you to talk about why is immunization important for child survival?
Okay, thank you very much. So Nigeria has one of the highest childhood mortality rates, okay, and starting from 0 to 5 years, we have one of the highest. We go out and we see Nigeria painted in red because we have the highest in the world. And the causes of death in these children are largely preventable, including deaths from vaccine-preventable diseases. So if you can just give an injection or give a drop of a vaccine into a child's mouth, and that child is prevented from having a condition like polio, for instance. Thank God Nigeria has been declared polio-free, but it took us a while before we got there. We were competing with countries like Afghanistan and Pakistan. We were in war. We were not in war at that time, you know. But now, thank God, we have gone past that. But if you can prevent this infection, why not get it? So we have conditions like tuberculosis. Many people relate tuberculosis to cough. It causes cough, but it can cause meningitis as infection of the covering of the brain. It can cause a bloodstream infection when we have this disseminated tuberculosis. It can affect the spine. That child may become paralyzed for life. So why do you want to risk that? Okay? Then we have other conditions, meningitis, rubella, which has also been introduced. If the mother has rubella when she's pregnant, that child may come down.
What is rubella?
Okay, what we call German measles. It's called German measles. So it's like measles, but it's not as serious as measles. So many people may not even know that they had it. They just have a small rash and that's it. But if a pregnant woman gets rubella while she's pregnant, that child may not form properly and may end up with a heart problem. It may have cataracts, which may result in blindness, and those things are preventable. We have tuberculosis, we have diphtheria, we have pertussis, we have rotavirus, which has been introduced. A lot of children, when I was in training, I remember seeing a mother bring this child to the hospital. That child was severely dehydrated. He had passed so much stool and passed stool in front of me, and the old nappy was wet. It was cloth nappy, was soaked. This child died eventually. But why didn't this mother come to hospital early? She said, they said, Igbeini, Igbeini. Even if it's Igbeini, for those that don't understand Yoruba, it's teething that was causing the diarrhea. Come to hospital and let the doctors tell you not to worry. You know, she came so late, that child died. Rotavirus can prevent those kind of conditions in children. So we're seeing less and less of these conditions that were killing these children now. However, we're having challenges now because many more people are not going for these vaccinations. So majority, about 20 to 25% of killers of children under 5 are preventable, are vaccine preventable conditions. So if we can immunize all the children who are due for immunization, then we're going to make a significant headway in reducing childhood mortality in our country.
Okay, my next section will go to Oluwakemi, who is here representing the Lagos State Primary Healthcare Board on the program. Barriers and hindrances have been identified by Alhaji and, of course, Prof. I just want to know what the Lagos State Immunization Healthcare Board, rather, is doing to ensure that more children have access to immunization in the state.
Okay, thank you. Thank you for that question. So one of the things that the Lagos State government is doing is making the vaccines available. And through the federal government and the MPHCDA, vaccines are supplied to the state and kept at appropriate cold chain, which is +2 to +8. That's one. Two, we definitely cannot reduce, or we can't tell them what to believe and what not to believe. We can also just advocate to them, have community engagement with the community stakeholders, and that's what we do. We have community engagement because, I mean, you can't come into my house or my environment without talking to me. So we have to have the gatekeepers of the community and have an entrance. So we have community stakeholders meeting, and we look for how to engage the mothers and speak to them, educate them on vaccine preventable diseases, educate them on the benefits of getting their children immunized, and then cost of getting vaccines of getting the mothers to healthcare facilities. I mean, we have community outreaches. We take the vaccines to them now. We look for viable sites, take the vaccines to the mothers, and then we get them vaccinated. Also, we also look for, the government is looking for how to maybe provide incentives, which we're still looking into through partners, and then for maybe children that have completed their immunization schedule up to 5 years now. So we're looking for how to appreciate them somehow. It might not be financial, but maybe a way to say that, okay, you've achieved this, and then we're going to maybe recognize you in the community, maybe in the state newsletter. And then, I mean, if I see my face on the newsletter and the community members too, I want to see my daughter's face, I want to see my face on the newsletter. Also, the government is also, through the BHCPF funds, providing providing funds for outreaches, special outreaches, special programs. Also, we also participate in campaigns organized by the federal government when they organize the campaigns to take these vaccines to the children in their households, where we do house-to-house vaccinations. Yes. Also, we do mobile tracking.
You also do school?
We do school. Well, school. That was for HPV vaccination. We went to schools, but for the normal vaccinations where we do community and fixed sessions, we don't go to schools.
Okay.
Yes, we go to the community to find the children 0 to 5 years, or we go to the markets as well. Sometimes we have evening vaccinations, because some of the clients or the children cannot be met during the day, so we do evening vaccinations.
So after school?
Yes.
Okay.
So the government is actually doing a lot, making vaccine available, and then also looking for how to get it to them in the community. So Lagos State government is really pushing for a coverage of over 95%. The state's coverage is supposed to be 85%, but Lagos State as the center of excellence.
You've added more. Okay, let me come back to you here. I know that just like Oluwakemi said, community-based organizations are very important, especially when it comes to cascading information to such as this. And so how your organization, how much of the CBOs are you working with at ensuring the scale-up of the immunization process?
Yes, thank you. It is an area where we are doing a lot. And just to also support what she said, Lagos is doing a lot.
Okay.
And we are just there to fill the gaps. There is a set of children that are called zero-dose children. Zero-dose means they were not opportune to even have a single vaccine at their childhood.
Okay.
In Nigeria, the last statistics we have, about 18% of children are in that category, which is over 2 million, about 2.2 million, which is much.
Is this concentrated in any part of the country or generally?
It's widespread,
okay.
And that's the national average. Lagos, because they are doing well, Lagos is about 5%. It's not up to the national.
Of the 18%?
No.
Okay, in the entire state, about 5%.
In the entire state,
okay.
About 5%. And these have been found through research that they are in locations, in localized areas, let me put it that way, particularly the rural areas. And they're also common with children that are born by young mothers, below 25 years. So Lagos is about 5% of the children. And one key thing that we are doing to support Lagos State to cover that unimmunized children and some other categories of that we call under-immunized is to work with the CBOs.
Okay.
And they are at the grassroots. And as the reps here have mentioned, they live with the people, they know them, they work in the contest, and they are ready tools to be used. I mean, with little incentive. You had his testimony on his own, he's funding this, funding that, and that's the spirit they bring into the work, even as volunteers. So we are working with them a lot on community mobilization and also on advocacy, for them to help cover the gaps. And as I mentioned earlier, we support states in mobilizing funds, and particularly for this particular project that is looking at zero-dose children and under-immunized children, GSK was very
instrumental
into funding that currently for the next 4 years. And we are also working with the CBOs to look at innovative ways of community mobilization. They have been doing it, but there are rooms for improvement. So in terms of capacity building for them to do better and to be more innovative in the way they do the community mobilization. So that apart from intention to take immunization, particularly on the side of the caregiver, they are practically seeing taking the immunization, not just the intention. We want to break all barriers,
Right.
and CBOs are very instrumental to this.
Okay, let me build on that and come back to you, Alaji. Community-based organizations, in your own community, can you tell us the role of the churches and the mosques in ensuring that this message is also taken to the very the last person, because you speak the language that the people understand. So tell us, the church, the mosques, the role that they play here.
So thank you very much. The way we do our work at the community level is that we always meet with the religious leader.
Okay.
We involve them in most of the program we are doing, apart from even on immunization, in most of the program. And Lagos State also, they have a platform that they are meeting all the religious leaders. They are even coming together, both Muslim, Christian, and other traditional leaders. They are meeting, and they always inform them about the program on immunization, on any other program. But basically for our own, we always have meeting. On Friday, we go to Central Mosque. During the prayer, we'll have talked to the chief imam that we want to discuss about immunization, about the vaccine, and they will ask us to come, and we talk to our women and our men, not only women alone, because most of the challenges we are facing are men, particularly those religious believer that believe that it's only God
That can heal.
God is protecting them, protecting their children. They don't know that apart from believing in God, you still need to do some immunity, something that will protect your immune system. So we talk to them, and apart from that, the other tribe, like Hausas, the people from the north, they don't even believe in immunization at all.
Right.
And if you don't understand their language, you can't go to their
community,
to their constituency.
Right.
So what we used to do is to identify their Sheriki, which is their leader that is living within us. We will be with us. We will go together with the MOH, the OIC, and some health worker to go to their area, to go, and even some of them will not even want to come out, and they don't want people to go to
come
their,
into them.
So we go with the team to go and give them whatever. But if they don't want to allow, what we used to do is to let them know the implication that we will not allow them to stay within our community, so that they will not use their own to cause problem for other children. So at the end of the day, since they want to stay in Lagos, they will accept. But some of them, they can move from that place to another area. By the time you come there, they are like cow. They move around.
They move
anytime.
from one place
so
to the
by
other.
the time you come to their area uncompleted, because majority of them live in non-completed building. So by the time you come there, you not see them. Where is your children? No, they have gone. They are not. They are in the north. So, but we are doing a lot in reaching out to. But some of the challenges we are facing is the people at the slum. Some of them, they don't even want anybody to come to them. But we are still meeting with their leaders, because some of them, they don't believe in other religion, like going to churches, going to mosque. But they believe that they are on their own. But by the time we discuss with the traditional ruler of the entire town, they will call their attention that this is the program we are doing, and they need to take part in it. But we are going to improve in it, because in Ikorodu, because of the environment, we did not pass at all in the last immunization period. And when they did a program for us, they identify it, and they even showcase it to us that we need to improve. So in fact, because of this program, I have to call all the WAC chairmen for a meeting tomorrow to brief them on how to improve on the immunization process.
Okay, my question for you, Prof. I want you to mention most essential vaccines recommended for children, and then how do you handle the aftermath of, taking vaccines for your children, because I know that there was one I took for my baby, my first child, I think it was pent, and the fever was so much. I started praying and neutralizing the fever. So it was later that they said, okay, it's just the effect, it will fizzle out, just administer paracetamol. But I noticed that some women will give their babies the paracetamol before taking the vaccine. Is that right? So list the essential vaccines to take, and then how to handle the aftermath of taking vaccinations for your children.
Okay, thank you. So the vaccines that are recommended for children, there are quite a number. But those we have in our national program, we have the
green card.
Yes, we have the BCG, which protects against tuberculosis. We have oral polio, which is now going into injectable polio. So that is preventing against poliovirus, poliomyelitis, which is a condition, a viral condition that causes people to be unable to walk. Okay. Then we have the pneumococcal vaccine. Pneumococcal vaccine. So it's called the PCV. That prevents against bloodstream infection, and also the pneumococcus can cause bloodstream infection and brain infection, meningitis. Okay. Then we have the rotavirus vaccine I mentioned earlier.
And rotavirus is taken 2 or 3 times?
3 times. Depends on the age at which you meet the child.
Okay.
Then we have the Penta, which you mentioned. Penta is 5, means 5. So it has 5 in 1. So we have the diphtheria vaccine, we have the pertussis vaccine, we have the tetanus vaccine, we have the Haemophilus influenza, which also causes meningitis and bloodstream infection, and we have the hepatitis B vaccine.
So it's 5 in 1.
All
That's why
5
it's very
in
strong.
1. So what we do, or what we advise health workers to do, is to educate parents. I also experienced that with my children. So my first daughter got her vaccine and she had this terrible fever. But because I knew that I was to expect the fever, after the vaccine, you start your paracetamol and you give it as is prescribed, so that it reduces the intensity of that fever. We also ask mothers to take a sponge if there is a need to expose the child so that the temperature does not get too high. But if you are worried, please go back to the hospital. That is not enough not to take that vaccine, because it's preventing 5 different conditions just because the child has a fever. Which one weighs more? Getting any of those diseases or the fever? Yes, 1 night's sleep compared to your child's life or normal development is, it's nothing comparable. Then we have the measles vaccine, which prevents against measles. When I was training, we saw a lot of measles. I've not seen one. Even when we see, it's very mild. Then we have the meningitis vaccine. Then we have the yellow fever vaccine as well.
Okay, are you done, Joy?
But there was one,
yes,
flu, but it's not on that green card.
So we have some other vaccines that are not on the national program. They are not available free to mothers. So these vaccines are very expensive, but through the provision by the government and partners, is being made available for us free. All we need to do is get to that health facility. Some people say they need to take a bus to that place. The cost implication, we should look at it. If your child falls ill and needs to be admitted in hospital, that means you can't go to the work that you really wanted to go to and you didn't go for immunization. You are going to spend money to look after the child. Then you have the emotional trauma of, is this child going to survive or not? You are sleeping in hospital, and it's so much when you consider the negatives of not vaccinating your child to vaccinating the child. There was another question you asked about how do you take analgesic before? Okay, so immediately after the vaccine, you start the analgesic to prevent or reduce the effect of that. I just wanted to add something to the 0-dose children that Mr. Olatunde mentioned. We have them all over Nigeria, okay, but they are more in the north. Lagos State is part. All the LGAs in Nigeria, all the 774 LGAs have zero dose children. And we need to reach them. So, thank you.
Okay, my next question will be for Oluwakemi and, of course, Olatunde. We have identified certain barriers preventing some children from having access to immunization. But what are those sustainable solutions that government and, of course, NGOs like Save the Children Initiative should provide to ensure that these children have access to immunization? Let me start with you, Kemi.
Okay, thank you. The first thing is recruitment of trained personnel. Right now, we have a shortage, and I don't think it's just in Lagos State. I think it's all over. And right now, the Lagos State is doing, the Lagos State Primary Healthcare Board just concluded exit replacement of those that retired. And then that's still not enough to bridge the gap of the HRH for the health facilities. So the first thing would be recruitment, which is in the pipeline for the state. Also, capacity building. We build the capacity of our healthcare workers like regularly on new trends, current trends, on immunization, and every other thing that needs to be known on in the healthcare sector. We also do mobile tracking. We do digital tracking of our defaulters. We track defaulters. We call them. We find out if they are still in that locale, and then to know if they've moved to. So there's intra-LGA tracking and there's inter-LGA tracking. So intra-LGA tracking is like Alaji said, people have migrated, a lot of people have migrated to Ikorodu. So let's assume I live in Oshodi and while tracking me as a defaulter, they can't find me anymore. So they call me and then I tell them, oh, now I live in Ikorodu, and then they start asking me questions. Okay, so where do you take your immunization now? Oh, I've not found a health center to take. Okay, so the LIO or the OIC of this health facility or the LGA communicates with those at the other LGA, and that's the inter-LGA tracking. So we also have the intra-LGA tracking where maybe somebody has moved from Elepe to Ikorodu West, something like that. And so you find out if this person can still continue the immunization here, or, you know, some of them, maybe because of the attitude, or maybe because of the relationship they had with a health worker. I've had that experience where someone moved to Mowe from Bariga and still decided to come to my facility. And I had to tell her that, oh, no, don't worry, you can get it from the nearest facility that is close to Lagos State, or you can also do it in Ogun State. We are all the same. We are all health workers, I mean. So we have those that are, and that's where the cost too comes in. Some of them really do not want to go to other facilities. So they tell their husbands, oh, it will take me 1,000 naira to get to this place. Meanwhile, there's a facility around where they can, because we have 330 primary healthcare facilities in Lagos State now. We don't have in all wards, but we have at least 330 facilities that can be accessed easily by the caregivers. Also, we do cold chain maintenance. Our vaccines are always at the recommended cold chain, so we do not give vaccines that are not potent to these children. Monitoring and evaluation data. Okay. After immunization, there's data capturing. We do SMS data capturing in some states. We do immediate data capturing where data tools are entered, and then we track those data. It still goes to tell us the coverage that we're having, and then also to track defaulters. So these are the things that we're doing to help clients access immunization, making vaccine available, making health workers available, and getting them tracked as well.
Okay, that's on the part of the government.
Yes, on the part of NGOs, because of scarce resource or resources that are available for healthcare, to sustain the potential or increase and sustain coverage is to look at alternative and cheap technologies. Let me put it that way. Let me take an example. For the immunization, we need cold chain. And it's not every community or every local government that we have power supply. So issue of solar or alternative source of power is very important for government to look into. She has mentioned the issue of capacity building. I would say, okay, a whole system strengthening approach so that the government structures and the systems can function very well. Because that's the only vehicle, viable vehicle and sustaining vehicle to take these vaccines to the beneficiaries. But more importantly is the people, the communities, for them to be involved in their own health. We need to empower them to say that this is very important and I need to be involved. And not just being involved by mere information, for them to participate. We need community mobilizers. We need community leaders that are committed to this. We need religious leaders that are committed to this, that people listen to. And if that conviction is there, all other barriers can be overcome. We have situations where, possibly because of 500 naira, a mother is not going for immunization. But if that mother is aware and is convinced, that mother will rather trek to that health facility. So, to bring in the people, that's very important. Let them take charge of their own health. Let them also demand for this. There will be campaigns, there will be these philanthropies, even counselor. Anytime they ask them what do they need in their community, health should be a priority. And if at that level, they can drive it from that level, there is nothing that will be more sustainable than that. And they will also help governments in covering gaps within the development association, within the committees that are being set up, and to strengthen them to be able to do this. It's not just to ask them to do it, we also need to build their capacity. So as we are looking at health workers building their capacity, we're also looking at building the capacity of the CBOs, of community organizations, and one other group that is also very important to us are the children themselves. To form advocates from children, even in school, advocacy groups.
Or make them ambassadors.
Ambassadors that they can also go out. And that's a key one. From the beneficiaries, mothers, caregivers that have really taken charge of their health and that of their caregiver, of their children. We make them advocates or champions. For them to also mobilize their peers, for them to participate fully well. So I think that's very important.
Okay, Prof, the theme for this year is humanly possible, saving lives through immunization. So are there other people who are also key to ensuring that this campaign is sustainable aside the healthcare workers themselves?
Okay, thank you very much. So for information to get across to the people, we need everybody to be on board, including the mainstream media like you guys. So we need you to help in disseminating information about immunization, programs that people watch, has high viewership. Let's slot in immunization jingles or talks there. The way people get information, they have information which is genuine, clear, based on science. There's misinformation. Someone says, haven't you heard? They said that immunization, it can cause sterility. It can cause this one. No, I'm not collecting. They don't have any basis for that. And it becomes a rumor and it spreads around. And that's part of what happened with the HPV vaccine. Because we're expecting Lagos to be high on top there. But it was the other way around. Other states did much better than we did in Lagos State. Okay, so we have the misinformation. They don't understand the gravity of what they're doing, how it's going to deal with people. Then we have disinformation. Some people just say, those Lagos State people, I'll show them. For whatever reason, and it just spreads wrong information. I know they say bad news spreads fast, and that's what sticks in the minds of people. So we need each and every one of us, mainstream media, social media, very important. Almost all Nigerians have a phone that you can watch TikTok or watch one thing or the other there. So we need social media influencers. All of us must come on board so that we can communicate the right message to our people. The Pediatric Association of Nigeria has, in the last few weeks, We have been doing training who we call immunization champions. I'm one, and I'm here today. So we want, apart from healthcare workers, mainstream media, social media, everybody that is involved. And I see immunization as what I can call individual social responsibility. Because if I say I don't want to take measles for my child, for instance, and my child comes down with measles, it's going to infect another child who probably is not yet due for his measles vaccine. So we have to be responsible to ourselves. And if we choose not to be responsible to ourselves, we should be responsible to our neighbors. So we should see immunization as our own social responsibility to ourselves and to the community.
Many thanks for staying tuned. It's still the conversation here on Lagos Television, and in the program today we are taking a look at the World Immunization Week 2024. We still have our guest in the studio this morning. Before we allow them go, of course, maybe we can ask them all to share personal experiences on things about immunization that they'd like to. Sometimes when you tell a story, you get it into people's subconscious in the most way. Prof, is there any story that resonates with you? I know you have plenty, but is there any particular one that resonates with you that you'd like to share with the viewers this morning on non-compliance with immunization generally?
Okay, thank you. I remember this very vividly because I'm a teacher. A day, one of my students presented a child to me, and they said the mother had gotten all the immunizations for the child that were due. So I said, what is all? She said she didn't bother to ask. So I asked the mother, so which ones have you collected for your child? Because normally you're supposed to ask, have you taken BCG, this and so you are sure the child has been fully immunized for his age. If not, then you can refer to the health center. And the mother said, Koda, gbogbo iton gbe wale ni mo ti gba. So I said, gbogbo iton gbe wale, okay. And that's polio. Then we're doing house-to-house polio and all that mop-up. So I asked the student, what do you know about this? You see what your patient is saying. So I had to take time to educate that mother. So education is very important. Letting the mothers know, mothers and fathers really, because Alaji said the fathers are also, because if the father knows, Mama Bisi, she was born mother in Logbabera Gesara, de Lola no tori mo lo soja. Yeah, Ola. If it's tomorrow, whether the Baba Bisi and Mama Bisi, both of them will go to the health center together to make sure that these children get immunized. And like I said earlier on, it is our social responsibility to our children and to our community at large. Nítorí náà gbogbo àwọn tó ń wò wá o.
I like that.
Láyé kí n sọ Yorùbá díẹ̀ o. Kò dán mọ́ràn o ṣùgbọ́n ẹ gbà bó ṣe rí o. Ìyá Bísí, Ìyá Ṣọlá, Ìyá Nkechi, carry your pikin go health center o. Go get immunization o. Immunizations dey save these children's life o. Ẹ gbá ọmọ yín lọ gba abẹ́rẹ́ àjẹsára o. Gbogbo àrùn tó ń gbógun ti àwọn ọmọ kékeré láàárín ìgbà tá ti bí wọn sísí di ọmọ ọdún 5 gbogbo ẹni ìjọba ti pèsè fún wa lọ́fẹ̀ẹ́ ni o. Kẹ́ lọ gbà ó ẹ má jẹ́ kó ṣòfò àrùn burúkú ò ní súnmọ́ àgọ́ wa o. Ní pàápàá ìtàn pè ní HPV ó ń gbógun ti àrùn jẹjẹrẹ ẹnu ilé ọmọ fún gbogbo àwọn ọmọ wa ọdún 9 sí ọdún 14 gbogbo wa ọ̀fẹ́ ló wà ń bẹ̀ o. Ẹ má jẹ́ kó dọ̀là ká wá ní mbàdẹ̀ tí mo àbámọ̀ kò ní súnmọ́ sàkání wa o. Ẹ ṣé.
Thank you for that.
So before we move to, I want you to list the stages where these immunizations, these vaccines are taken. I know at birth, 6 weeks. So can we just list them?
Okay.
To 5 years, yeah.
So at birth, within the first week of life, the child is supposed to get the BCG vaccine, which protects against tuberculosis, oral polio 1, and the HPV. Oral polio 0 and HPV 0. Then at 6 weeks, he gets the Penta, which I said covers against 5, and also gets oral polio, gets PCV, and also gets Rota. At 10 weeks, so 0, 6, 10 weeks, then 14 weeks. So at 10 weeks, he gets the Penta 2, okay? Gets the PCV 2, and gets the oral polio 2. At
14 weeks?
14 weeks, he gets Penta 3, PCV 3, Rota. and
6 months.
the hepatitis B. I think it's the hepatitis B.
Yeah,
The IPV.
IPV,
Oh, yes, you get the
that's
IPV at 14 weeks, yes. So, like I said, OPV was metamorphosed into IPV at 14 weeks. Then at 6 months, because we don't want to lose track of these children, and also because vitamin A is also important. It's not an immunization per se, but it helps these children.
That's the one they...
Yeah, so they put this in the mouth at 6 months. Then at 9 months, they come for their measles vaccine. They also get their yellow fever vaccine.
Meningitis.
And the meningitis vaccine. And now I think we're giving 18 months. Or is it 12 months?
12 months.
12
After 9
months,
is
we're giving
the
also.
child is a year.
Between 12 and 15 months, we're giving the second dose of measles as well to these children.
And goes on to 5 years.
Yes.
So
So
after 5 years,
we are still
no more.
monitoring these children. Ideally, we're supposed to get the booster doses, but those are not yet in
Available.
the national program. But they're available at for a fee.
You can pay to get
You know,
those
you can
ones.
pay to get those
Private
ones.
hospitals.
Your
The experience. I'm sure you have plenty as state immunization officer, but one that
Oh,
is,
sure. So for me, I really like going to the riverine areas to to monitor, during activities. Yes, you would think that you would have a lot of resistance or hesitancy in those areas, but trust me, you have more hesitancy among the elites.
True.
Yeah, because they prefer the vaccines that are procured by private facilities to what
is
the
that
government
lack
is.
of trust or?
Yeah, I think it's just the lack of trust, and they feel that anything, no,
Anything
in
that is
Nigeria, anything that is free is not
is not the original.
Yes, so generally, I have had, the polio vaccine era, the polio, oral polio campaign. I actually had one issue where in fact, the LGA could not resolve. I had to go there, in fact, I had to start talking about the type of wild polio viruses that we have, the type of polio vaccines that we have, when they would have it. Oh, my child has had immunization, the schedule, my child, oh yes. They actually had twins in that house. And I did not know. They had twins and they had a toddler. Okay. The twins were, I think, 3 months. And then they had a toddler. So we would have actually missed those 3 children. So after educating, they had to call their aunt, who was a medical doctor in Saudi Arabia, to confirm.
Take it or not.
So
Yes.
One in Saudi Arabia
Until she told them to take it before they allowed the implementers give the vaccine. I mean, it's a whole lot being on the field. Yes, it is a whole lot.
But very quickly, for the polio vaccine, which is the
Yes.
oral, can there be too many times that a child can take it?
No,
So as many times
as many
it is
times,
available.
yes, as
Okay.
many times as it is
Okay,
introduced.
Olaside.
Let's take Alaji.
Sorry, can I add to it? Because we usually have environmental samples taken, CVPV2. There isn't that outbreak, but there are samples taken, and we've had some form of outbreaks taken from environmental samples. We have had positive results. So we know that we're polio certified, we're free of polio, but then
We can't go to bed.
We can't go to bed.
Right,
Yes.
we can't go to bed.
Thank you.
Alaji, because you are in the community, I'm sure that, of course, you already gave us an example earlier where you do plenty komos. So, again, any story that you'd like to
Yes,
share?
I have many stories. Let me just,
Definitely.
mention one.
Okay.
There was a day I was at the facility. I always visit the facility every day to see whether the staffs, they are on ground, to see whether they are attending to clients. So a doctor just called me, sir, come and see you. I said, what? He said, this is a 13 years old boy. Touch the bone. I now touch the bone. The bone is just like flesh. The bone is not strong at all, and it didn't grow well. I now said, madam, what happened? Did you get all your immunization or whatever? I said, yes. I said, are you sure? Go and bring your card. And your child will stay here. Go and bring your child and the card. So she went like about 4 hours.
Looking
The woman
for the card.
could not
No
be able
card.
to come. I have to trace the woman to the house with the child to ask her more questions. At the end of the day, he said, I did not collect one vaccine, one immunization. I said, look at what you caused to your child now. The child could not be able to grow well, and the bone is like a biscuit. So I now asked the doctor, please refer the woman to General Hospital or Lasut for at least they will be able to use her as a research so that it will be an example to others. So with that, I have to go to that community where that woman stays to educate them, to let them know the implication or the importance of vaccine or immunization. And the woman could not be able to do anything again. And I know that will have caused a problem between the two of them, the husband and wife. Maybe she did not inform the husband that she needs to go, or it's the cause of from the husband. So maybe with that, it can even separate them. So I have many of that. Right. There was a research that Save the Children asked us to do on immunization,
polio.
It's not polio.
Do you know what he's trying to say?
About 3, 4, 5 years ago on pneumonia. Pneumonia. Yeah. So I was one of the assistant researchers in Ikorodu. Okay. We got to, through data collection from the PAC, we realized that there was a woman in one estate that came to the center for immunization. But they did not do a thorough investigation very well to identify whether the child has pneumonia or not. So by the time we traced the address, when we got there, we realized that the woman has TB, tuberculosis. You know, the woman will not complain. The doctor will not even ask, except the woman complain that I have cough and whatever. So on getting there, we realized that the woman have
so in essence, it's important that you're thorough and you tell your doctors what exactly is going on
you need
because
to speak
that
out.
is the only way they can treat you.
Yes.
All right, we need to hear from you before we go this morning.
Okay.
I'm sure you also have plenty of stories, but let's quickly take a short one.
All right, to be a personal story.
Okay.
I noticed that the distance in terms of years between myself and my siblings are about 7 years. There are 3 of us. Okay. So I asked my mom.
Are you the first or the last?
In the middle. So I asked my mom, why did such a large gap? And my sister's name is Rocco. Why Rocco? You know, and that's how I heard the story of Abiku. That, okay, she was not the first born, and that, you know, she had 9 of us. When you say Ikunle Mason, and when a village woman say Ikunle Mason, meaning she gave back 9 times, and only 3 of us survived. And she believed it's because of Abiku or some other things, traditional. So if that kind of thing happened about 50 years ago, and it's still happening now, then it's unacceptable. Okay. And so in that wise, I will really want all hands to be on deck to support government, including the private sector. Either private service provider, companies, I mentioned GSK, they have come in, other companies, other organizations should come in to support government so that the issue of 0 dose or under-immunized children will not happen. Right. I'm lucky I survived the 0 dose. The only 3 out of 9 survived. But a lot of children are not so lucky to survive.
All right, Jibala, any questions?
Okay, my question will be to Prof. I know some parents are watching us right now, mothers, fathers, members of communities. What will be your message to them so that they will have this proper perception as regards immunization of their children?
Okay, immunization has been thoroughly researched. So all the immunization, before a drug is put out into the community for us to use, Studies have been done over and over to ensure that they are safe to be administered to people. So they've been tested and they are trusted. They are safe for our children. They are safe for us because we have the COVID vaccine, we have the HPV vaccine, even for older children. So my advice is that we take our children to the health centers or hospitals, wherever, to get these immunizations. They are available for us free of charge. If you choose to pay for yours, go to a private facility to go get one. However, make sure all your children are vaccinated to prevent all these conditions, infections that can kill these children. If the children are lucky, they survive, majority of them will survive with what we call sequelae. So they have complications of that disease. Some of them become blind, some of them become deaf, some of them are unable to even walk again. A child who was already running around gets meningitis and is not able to walk again for the rest of his life.
Right.
So that parent ends up seeing that child and knowing that this could have been prevented by just immunization. So my message to us parents is that we make sure we immunize all our children and be immunization champions.
Right.
When you have a friend who has just given birth, oh, have you gotten the BCG for your child? Oh, have you gone, you know? And follow up to make sure that all children get immunized. We need to reduce the zero dose and the under-immunized children in our country. Thank you.
Okay, as we close this conversation today on a lighter note, Oluwakemi, do you also ensure that especially the nurses and caregivers at the health centers have the right attitude? Because again, this also chases mothers away.
Yeah, because let me share my own experience.
Joy, you are not sharing any experience. Let's hear from Oluwakemi. We need to go. We need to go, Joy. Please, Oluwakemi, go ahead.
Keep quiet.
Okay. Okay, so I think it goes both ways. What attitude are you as a caregiver bringing to the health facility?
Okay.
Well, all humans. Yeah, there's a tendency for me to go off when I feel that maybe you've not spoken to me properly.
True.
So then, what the government is doing is continuous capacity building, which we still try to tell the health workers, whatever problem you have from
Don't
your
transfer
home,
aggression.
whatever
on your
attitude
patients.
you have, put it aside and attend to your clients. And no matter how aggressive your clients might get the second person to, intervene at that point. You don't need to react as well. You don't need to be rude to your clients. I mean, if it was a private setting, you won't be rude to your clients because you know that
You'll be fired.
you will be fired.
Yeah.
So the government is putting those measures into place.